I decided to become a physician when I was in college. However, I think that an experience with seeing a family member suffer from cancer had the biggest impact on me, and that was when I was very young. So it was very formative. I didn't realize it at the time, but I do recall that experience quite vividly, and that really gave me a heart to help cancer patients, and it's what fuels my desire to always help people with cancer, even when I'm not on the job, so to speak. The patient is really the center of the treatment plan, and we're really a team. It's not just a head and neck surgeon like myself, but it's a head and neck surgeon, a radiation oncologist, a medical oncologist, speech and language pathologist. We have nursing care, we have MAs. There's a big team that is involved in helping the patients to make these decisions for themselves. So they need to hear all of the different perspectives so that they can then take that information and make a decision. Additionally, we also discuss every patient's care with our entire head and neck tumor center team once a week so that we can come up with a consensus recommendation to help give the patients guidance so that when they may be confused or have uncertainty in their mind about all of this information that they've heard, we can provide them with, here's our consensus, and then they can make an informed decision that they feel most comfortable with. Head and neck cancers are increasing, that is some of them, specifically the ones that are related to human papillomavirus. Smoking-related head and neck cancers have been declining over the decades. What I'm most excited about for the future is seeing how we can integrate the work that we're doing in the lab as well as our clinical trials in order to decrease cancer prevalence, so the occurrence of cancer, as well as improve the treatment outcomes in cancer. And I really think that we are on the verge of improving the outcomes for head and neck cancer more so than we have in the last several decades, specifically as a result of much of the research that's occurring at Siteman right now. My research interest involves how diet and metabolism affect the body's ability to fight cancer. And of course, I focus on head and neck cancer. Specifically, we're studying how different classes of fats and other small molecules prevent the immune system from being able to kill off a cancer, which is one of the immune system's main jobs. And so we have research both in the lab where we're studying the effects of these different molecules and compounds on the immune system function, as well as work that we're doing using samples that are donated by patients with head and neck cancer in order to understand how we can improve that immune response against cancer. The most rewarding part of being a surgical oncologist is walking through my patients' journey with them, from the day I meet them in clinic to the day we go to the operating room, or if surgery is not the answer, still being an important part of their longitudinal care, helping to surveil them, in other words, determine whether or not their cancer is remaining controlled, and seeing them be able to flourish. That is, whether that's spending time with families, seeing a grandchild be born, seeing a child or a grandchild graduate from high school or college. That's really what I do this for.